More analysis on the importance of a restful night's sleep and sleep-related businesses. We are joined by Dr. Lourdes DelRosso. She's a sleep physician at Seattle's Children's Hospital and associate professor at the University of Washington School of Medicine. It is great to have you. Thanks very much for joining us.
Thank you very much for inviting me. This is an honor for me to be here today.
Well, growing up, I heard it all the time. Make sure you get a good night's rest. But in this time of the pandemic, it's even more important, isn't it?
Yes, we need to be strong, we need to have a good immune system, and we need to have all our abilities to be able to cope with the stress and the situation of the pandemic.
And there's a difference between something that is symptomatic, like because of the pandemic, and someone who has a sleep disorder. How can you separate those two, and why is it important to know the difference between the two?
That is a great question. Research has shown that people who already had some symptoms of a sleep disorder have worsened during the pandemic. So not just new sleep disorders, but people who already had some symptoms of insomnia. In fact, I was reading a research publication that about 27% of people who already had sleep disorders worsened to about 46%. So that is something to consider. But besides that, if you never had a sleep disorder and then suddenly are waking up through the night or have difficulty to sleep, or maybe just find yourself really tired during the day, you may be affected by stress of the pandemic or a sleep disorder that needs to be diagnosed.
You know, I'm one of those people because I had to do a certain amount of work from home, and I found my entire schedule getting turned upside down. And it found it easy to stay up way too late. Is that common? And what are the downsides of falling into that ugly cycle?
Yes, initially, during the first months of the lockdown, we noticed that a lot of people, including children that I work with, teenagers, started sleeping at their own time, and little by little started prolonging their bedtime until 10, 11, midnight, 1. And the advantage of being at home was that they were able to stay in bed until 10 in the morning, 11 in the morning. So we thought at the beginning that, well, all our problems are going to be solved because people can just sleep in and keep a longer schedule, but keep it consistent, even if it's later. But what happened is that it is not so, that people have difficulty now falling asleep and are waking through the night. And that, compounded with the stress of the pandemic, has made for worse sleep quality.
And for children and adults, I've read that it is also somewhat of a concern that lack of sleep can impact the way we react to the COVID vaccination.
We have studies with other vaccines, influenza vaccine and hepatitis, and those studies have proven that the antibodies that we develop after the vaccine are lower when we have poor sleep or sleep insufficiency the weeks before the vaccine. So I think that it would be safe to extrapolate to the COVID vaccine and try to get a good night's sleep.
Wow, that's fascinating. And again, not just for young people, but old. What about technology? People going to bed with a tablet, reading, or watching a show online. Is that generally a bad idea?
We recommend not to. Studies have shown that children, for example, who have electronics in the bedroom delay the sleep onset for about an hour. So I don't know, maybe the anxiety to have the electronics in the bedroom, or the desire to start texting or looking at the phone. That happens to me when I am on call and when I have my phone in my bedroom, is that I wake up more